Hello and welcome to this learning module. Today we will provide an overview of techniques to lift and move our patients. This video is intended to supplement any readings or coursework assigned by your instructor. The objectives for this learning module are: number 1, explain proper use of common devices to move patients. Number 2, describe proper body mechanics when lifting and moving a patient. And number 3, differentiate the terms emergency move and patient transfer moves and give examples of each. On a typical EMS call, the patient may need to be moved several times. If the patient is located in an area that is not accessible using an ambulance stretcher, a proper device to get the patient to the stretcher will need to be utilized. Once the patient is brought to the stretcher, they will need to be transferred onto the stretcher and secured for transport in the ambulance. Once the patient arrives at the hospital, they will need to be transferred from the ambulance stretcher to the hospital stretcher. EMS providers must become proficient in the proper selection and use of lifting and moving devices. Additionally, we must know how to use these devices to prevent injury to ourselves, our crew members, and the patient. This module will review the commonly used lifting and moving devices, as well as discuss how to safely move and transfer our patients. The wheeled ambulance stretcher is designed to safely secure a patient for transport in the back of the ambulance. Since these stretchers can weigh anywhere from 80 to 150 pounds, they are not designed to go up and down flights of stairs. Older style ambulance stretchers require at least 2 EMS providers to safely raise and lower the stretcher and to load and unload a patient from the ambulance. Newer ambulance stretchers may be battery operated or pneumatic and will lift and lower the patient with the push of a button. It's important for you to become familiar with the safety features, weight restrictions, and proper use of the stretchers utilized by your agency. Most stretchers have a safety harness at the head of the stretcher that goes over the patient's shoulders and around their chest. They will also have straps to secure the hips and legs. All restraint devices should be used when securing a patient to the stretcher. Failure to properly secure a patient using the lifting and moving devices, seatbelts, or restraint devices may lead to patient injury, provider injury, and possible legal consequences. In this image, we see an empty stretcher that shows the location of the restraint harness and belts. A long backboard is a rigid device that is used to transfer patients we need to be in a supine position and/or immobilized. These devices may also be referred to as spine boards, trauma boards, or long boards. Backboards are commonly made of plastic material that is resistant to blood and body fluids. If a patient is suspected to have sustained a neck or back injury, the providers will log roll the victim as a unit onto their side so the board can be placed behind them. The patient is then carefully rolled back onto the board without aggravating their injury. As with any lifting and moving device, the patient must be properly secured to the backboard. At a minimum, there should be a strap across the chest, hips, and legs. Some experts recommend the use of 2 straps in the shape of an X across the chest to keep the patient from sliding upwards and possibly off the board during transport. You will practice using this device in lab. In this image, we see a team of EMS providers and athletic trainers working together to log roll an injured hockey player onto a long backboard. The orthopedic stretcher seen here, more commonly referred to as a scoop stretcher, is a lifting and moving device that is designed to split in half down the middle so that one half can be placed under the patient's right side and the other half under the patient's left side. The 2 sides are then fastened together and the patient is secured to the device with chest, hip, and leg straps. The scoop stretcher can be adjusted to the patient's height, but must be adjusted while both halves are secured together. The scoop stretcher is an underutilized piece of lifting and moving equipment that is common on most ambulances. These devices are excellent for patients with hip injuries, muscle spasms to the neck and back area, and for patients who cannot be safely log rolled onto their side to be placed on a backboard. Backboards and scoop stretchers should not be used in patients who are experiencing respiratory distress because being secured in a supine position will likely increase their breathing difficulty. As the name implies, the stair chair is used to move a patient up or down a flight of stairs while in a seated position. To safely use a stair chair, the patient must be conscious and able to maintain their own airway. If the patient is unable to do this, then the stair chair is contraindicated and should not be used to move the patient. Stair chairs are excellent devices for moving patients who are having trouble breathing. It enables them to remain in an upright position, which makes it easier for them to breathe. Depending upon the manufacturer, a stair chair will have a chest and hip strap or straps that will cross the chest in the shape of an X. Stair chairs also have a lower leg strap that prevents the provider at the bottom of the stairs from being kicked by the patient as they're being moved. Modern stair chairs come with a traction device that enables the stair chair to glide down the stairs rather than be carried over the stairs. There are even battery-powered stair chairs available to glide a patient up or down stairs. From the patient perspective, being moved in a stair chair can be quite scary. It's important that we communicate to the patient and let them know what we are doing before we do it. This will keep them from reaching out to grab the banister and throwing you and your partner off balance. We've already talked about how the backboard and scoop stretcher can be used to move a patient in a supine position. There are several other devices that can be used to transfer a patient up or down stairs if they must remain supine. A patient can be rolled onto a blanket or sheet and carried to the ambulance stretcher. Several manufacturers make flexible stretchers that look like tarps with handles on them that will allow a patient to be securely moved up or down stairs in a supine position. Other types of flexible stretchers include the Reeve sleeve seen in the image on the left and the sked device seen in the image on the right. With proper training and equipment, both the Reeve sleeve and the sked stretcher can be used with ropes to lift and lower a patient that way. If you must carry or move somebody over rough or uneven terrain, a basket stretcher, also known as a Stokes basket, is usually the best way to achieve this. While these devices are not commonly found on an ambulance, your local fire department or rescue squad will likely have one of these available for use. Stokes baskets can also be used to lift or lower a patient vertically or horizontally when performing rope rescue. The image on the right shows a stainless steel Stokes basket loaded with rope rescue equipment and a long backboard. Some Stokes baskets, like the one in the image on the left, are made of a high-density polyethylene shell supported by a stainless steel outer rail. Most basket stretchers are designed to accommodate a patient who is immobilized on a backboard device. Body mechanics refers to the ways that our body moves to achieve a specific action. Maintaining proper body mechanics when lifting and moving patients will help to prevent injury to EMS providers. When lifting, your legs should be shoulder width apart and your feet should be positioned such that the center of gravity is balanced between them. You will tighten your back and use your core abdominal muscles to lock it into a slight curve. You will need to bend your legs to lower your torso and arms into position at the level of the device. When lifting, we always use the power grip, which means that your palms are in an upright position as you grasp the device. The power grip is illustrated here. When lifting, you want to keep the device close to your body and lift with your legs until you are fully standing. To lower a device, you will reverse these steps. You will practice proper lifting techniques in your labs. Before moving a patient, it's recommended that you ask the patient their weight, or if they're unable to communicate with you, estimate their weight. If you believe they are too heavy to be moved by you and your partner alone, you should request additional lifting assistance to the scene. Once you begin working at an agency, you will need to determine whether they have a policy regarding the maximum weight that two providers should attempt to move without requesting assistance. Regardless of the device, when moving a patient down the stairs, they should always be moved feet first. When rolling a patient on the stretcher, they should be moved feet first. This is done for patient safety because it's always better to have them strike something with their feet than with their head. With many lifting and moving devices, the provider at the feet will be walking backwards down the stairs. Whenever possible, a spotter should be behind them and should have a hand on their back or grasp their belt to keep them balanced. When lifting or moving a patient, the provider at the head is generally recognized to be the one who provides a countdown prior to initiating the move. Clear communication is a must to ensure that all team members move together as a single unit. Ergonomically speaking, when moving a patient on a wheeled ambulance stretcher, it's always better to push than pull the stretcher. Pulling puts more strain on the provider's back. So, when moving the stretcher to the ambulance, the provider at the head will push, while the provider at the feet will steer and guide the stretcher. In the image here, we see two EMTs removing the patient to be taken into the hospital emergency department. Notice that they are moving feet first as they go up the curb to get into the ED. An emergency move is used when there is imminent danger to the patient and/or EMS crew, and the patient must be carried, dragged, or pulled to a safe place before assessment and care can proceed. Examples might include fire or explosive hazards or incidents involving hazardous materials. When the decision is made to utilize an emergency move, protecting the patient's cervical spine becomes secondary to getting them to a safe place. Rescuers may need to drag the victim using the victim's arms, clothing, or a blanket, sheet, or throw rug. Please reference your textbook for more images and recommendations on how to perform different emergency moves. When the scene and patient are stable, EMTs should coordinate with one another to determine the best method to move the patient to the ambulance for transport. In patients without a suspected spinal injury, a direct lift from the ground to the stretcher or another moving device is appropriate. An extremity lift, as seen in the image here, might also be beneficial. Images of these procedures should be reviewed in your textbook. Using a blanket or sheet to lift the patient from the ground, chair, or bed is an excellent alternative to a direct or extremity lift. Once you arrive at the receiving facility, a sheet transfer will be used to slide the patient from your stretcher to the facility stretcher. This brings us to the end of this presentation. Here we see the learning objectives for this module. Can you demonstrate each of these objectives? If not, please consider going back to review any content that you might have struggled with. Thanks for watching this learning module.